Do you want some coffee?
Yeah, sure.
So I'm gonna meet Becky at yoga, and then we're gonna go.
Are you alright?
Yeah, I'm fine.
It's been happening a lot lately.
Yeah, I'm fine.
I think we should talk about this.
Okay.
I've been noticing you've been acting really different lately. Your writing's been getting a lot worse. You've been acting a little moody lately. I don't know, it just seems like a lot's changing with you. Are you sure you're actually alright?
Yeah, I'm sure I'm alright.
You know, I think we should probably book you for a doctor's appointment.
I don't want to see a doctor. I'm actually late to go see Becky, so goodbye.
So we're just going to run some simple motor tests just to see where you're at. So the first test I'm going to get you to do is to hold out your hand like this, take your finger, and just tap at a constant pace for me. Next, I'm going to get you to just follow my finger with your eyes. And now I want you to stick out your tongue for me and just hold it out like this. Alright, good. So we just looked up the Unified Huntington Disease Rating Scale for you when I did those motor tests. I think what I would like you to do is go see a geneticist, but first I want to learn about your family history a little bit. So do you know if you have a history of genetic conditions or neurological disorders or anything like that?
I don't think so, but I was adopted, so I'm not too sure about my biological parents.
Okay, so we'll send you into a genetic counselor and we'll go from there.
Hi Julie.
Hi.
I'm Dr. Tran. So your doctor tells me that he suspects that you have Huntington's disease. So I'm just going to need a blood sample and then we can run some tests and determine whether you have it or not.
Okay.
So I got the results back for your DNA test and I'm sorry to tell you that you do have Huntington's disease.
What's Huntington's disease?
Huntington's disease is a progressive degenerative brain disorder, which means that you have a defective gene, which is the HTT gene, and it's caused by an abnormal number of repeats of CAG. So people with Huntington's usually have above 40 repeats.
Well, we're planning on having children, so will there be any risk to the kids?
Huntington's is an autosomal dominant disorder, so your children will have 50% chance of inheriting the defective gene.
So over the last few months, I've noticed that she's been really moody. She's had mood swings, and she's been a lot more clumsy than normal. It's something I never noticed before. Could that be explained by this?
Yeah, those are very common symptoms seen in Huntington's disease.
Could we expect them to get any worse?
Depression is a very common symptom that you may experience. Some other symptoms include cognitive function, like difficulties making decisions, paying attention, even remembering small tasks, and you won't be able to drive. Some things you may notice in the beginning is a lot of fidgeting and involuntary movement, like your hips and your shoulders and your face. And this is called chorea, which is involuntary jerky movements. Also, you may have impaired balance and tics, sporadic muscle contractions. These are common symptoms. As your disease progresses, you could develop dysphagia, which is discomfort in swallowing, so you may have trouble eating, and your memory would get worse, and in later stages, chorea will be minimal, so you'll develop akinetic rigid syndrome, so you'll have trouble moving at this stage.
So I got the results of your tests, and I guess you already know what I'm about to tell you. You have Huntington's disease, as Dr. Tran probably already explained to you.
Yeah, she told me what would happen to me.
Probably the symptoms, yeah? So you're going to have some motor and psychiatric symptoms as well as the physical ones. Would you like to hear about the structures in the brain that are involved? Okay. Alright, I've got a good animation that I'll show you. In Huntington disease, the basal ganglia, cerebral cortex, and cerebellum are affected. The pallidum is a part of the basal ganglia where neurons become smaller and more densely packed, losing connections and causing volume loss. Progressive striatum degradation causes deficits in motor control, which result in symptoms such as choreic movements and reducing connections between the striatum and the frontal and parietal lobe of the cerebral cortex can cause problems with working memory and information processing, eventually leading to dementia.
So are there any side effects to these drugs?
So most of the drugs I prescribe to you have some side effects like fatigue, restlessness, hyperexcitability. Some will treat some symptoms but worsen others, so that's why I've given you a combination of drugs. I know this is a lot to take in. Your life is going to be very different now that you know this. I'm going to give you some lists of support groups. If you need any extra information or just want other people to talk to, I think that'll be a good way for you to help deal with this.
So how have you been feeling since you found out?
I don't really know, like, how are you supposed to deal with things like this?
Hi everybody, I'd like to welcome you back for February's support group for the family members of people with Huntington's. I'd like to welcome our new member, Herbert. Herbert, what brought you here this month?
Well, my wife has contracted Huntington's disease. She's had it for a couple months now, and it's been really tough. And we've been talking about having kids, and we're not really sure whether we should go through with it or not. We're both worried about whether our kids will have Huntington's disease and how that'll impact our lives. So it's been really tough for us to decide how we're going to go about deciding on whether or not to have kids.
So I have a daughter who has juvenile onset Huntington's disease. She started originally showing signs of jerky and involuntary movements, memory impairment, and seizures. I'm really scared I'm going to lose my daughter because juvenile onset Huntington's disease has a more rapid progression rate than adult onset Huntington's disease. I read somewhere that patients with juvenile onset Huntington's disease die normally within 10 years of onset as opposed to 25 years in adult onset Huntington's disease.
Well, I just wanted to remind both of you that there are lots of resources available to help you guys out. So even for children and adults with Huntington's disease, there's lots of medication that can help manage symptoms. As well, there's many professionals who can help you out, especially for children. There's child psychiatrists and behavior management specialists who can help you address the behavioral problems, speech-language pathologists who can help evaluate communication and swallowing problems, nutritionists who can consult you about how to meet the needs of your spouses or your children, your family members with Huntington's disease.
My spouse actually participated in some of the new clinical trials that they're offering, and they gave him this new drug called Ionis HTTRX. It's supposed to be a Huntington's disease gene silencer, and so far it's been really promising. His motor symptoms have sort of gotten better. He can write better now, and also he's less fidgety. So honestly, just look out for those new clinical trials and just stay positive.
Hi.
Hi! Are you Julie? Are you here for the clinical trials?
Yes.
My name is Dr. Varyvoda. Have you heard anything about the trials that are currently happening?
I went to a support group and they told me some things, but I'd like to know more about it. I already have Huntington's. Is there something more immediate? Can I get involved in research?
So there's actually a current clinical trial which is showing a lot of promise. There's a drug which can be injected into the spinal cord, and then it can reach the brain where it can stop cells from creating the Huntington protein, which might affect how your Huntington's disease progresses. If you're interested in that, we can review the eligibility criteria.
Okay.
So it's been 10 years. How has Julie been?
It's been really tough. We've tried our best to accommodate for her. Walking for her is really tough now. I usually have to help her down the stairs. Meals are getting a lot harder as well. I usually have to cut things up for her beforehand. She can't work anymore, and now I have to drive her wherever we go. It's just been really hard for us over the last few years.
And did you guys have kids?
We talked about it for a while, but we decided against having kids. We didn't want to have the risk of one of them having Huntington's as well and having them to go through that experience as well.